wie soll man sagen, grüß Gott, guten Tag. Sie sind Dobar Dan oder Dobar Večer oder was soll man sagen, es ist schon fast Večer. Sie kommen aus Belgrad oder aus Serbien, habe ich gehört. Und Sie werden uns jetzt über Bioptron-Lampen bei verschiedenen Gesundheitsstörungen berichten. Ist Aleksandar im Raum? Aleksandar? Was? Ist schon gefahren. Gut. It's your field. You can start now. Yes. Microphone. So. Sie haben draußen einen Stand mit den Bioptron-Lampen, mit diesen wunderbaren Lichtquellen, die so viel Gutes bewirken können bei einem Menschen. Und wir hören jetzt noch ein paar sehr interessante Sachen zu diesem Thema.
How does it? Okay. Good afternoon, everybody. Dear Professor, thank you for inviting me. It seems that I will be the only one not speaking Deutsch today, so I really apologize for that. Maybe next time. As you heard, my name is Aleksandar Neskovic, and I am a regional director for the company, medical director for the company called Zepter, and I have been working with Bioptron light therapy for the last 11 years. So I would like to give you some small introduction of what it is, how it can be used. I know that some of you are using it, so maybe just to expand your knowledge about it. I always like to start with a very brief introduction about the Bioptron itself. It's clinically tested, certified Swiss medical device that exists for almost 4 decades now, since 1988. It's registered in Europe, in USA, approved by the FDA, and in different countries around the world. In these 37 years, we have distributed over 3 million of these devices to homes of individual users, but also to a lot of hospitals, a lot of spa centers, sport clubs, and so on. Basically, the characteristics that make this device unique are that the light is polarized, it's polychromatic, it has a whole spectrum of visible light and a bit of infrared. It doesn't have a UV light. That's why it is completely safe to use even from the day one for babies and newborns. The light is incoherent and low energy. Because of all these characteristics, I would like to point out just this polychromatic light, because a lot of similar devices have either one wavelength or two wavelengths difference, so it's monochromatic or bichromatic, and that's for the indications are, let's say, limited. We have a very large spectrum, and each part of this spectrum of the light has a different effect on the body. For an example, the blue part has a very strong antibacterial effect, the green part affects the hormones and their balance. Also, it has anti-inflammatory effects and the effects on local and systemic circulation. That's why it is completely safe, like I said, for the use from the first day till the last day of your life. And we have a lot of course, human use it, but also, as you can see, we are using it in veterinary medicine. And what is new about the Bioptron that maybe some of you heard, maybe some of you haven't, is that since a few years ago, we have started using a very special molecule as an addition to the Bioptron-HPL-Therapie. It is called fullerene C60. We used it to make new filters for Bioptron devices, the improved filters. I will explain you why. But also we made some special and unique glasses. We are using fullerene to make some cosmetics that work on a biophysical level, but not on a biochemical. And the molecule itself, it is awarded by the Nobel Prize in 1996. The group of scientists from the photo won a Nobel Prize for its discovery. And it really is amazing. So far, I read recently that there are over 10,000 patents in medicine of using these molecules. We are the only ones using it for the optics. This molecule is the most symmetrical molecule that was ever discovered so far, and it is twisting, rotating 18 billion times per second. Also, it has some amazing characteristics, I will tell you, that is up to 250 times stronger antioxidant than, for example, vitamin C. So, of course, it's very important for the fight against the free radicals. Many studies have been done with it around the world. I will just point out a few. I will tell you that it is being used in the therapy of HIV because it stops the replication of the enzyme responsible for replication of HIV type 1 virus. It's being used for another viruses, but for example, in Taiwan, they are using it in the therapy of the lung cancer. Okay, so if I'm not wrong, Dr. Zurbuk, it's a pleasure to meet you, and I know that you've been doing a lot with Bioptron and the cancer therapy, so thank you for being here today. What we did is we put these molecules in the filters, and basically what we got is that the light is even more structured, even more organized. The light that was polarized now works on a quantum level, and basically it's bringing its quantum energetic properties to the molecules that it affects. Basically, it works through about 85% of biomolecules in our body. First of all, through the body water, which is about over 60% in the adult person, but also some very important molecules like DNA, like clathrin in our brain, and some others. So, like I mentioned before, the light around us is diffuse, so it's unorganized. What happens first in Bioptron, it gets through a Brewster mirror and become organized in parallel planes. It becomes polarized. But after it goes through the full filter with fullerene, the light gets another shape of moving, so it becomes spiral. You basically get two spirals in two opposite directions. So it's like the engine of the Boeing airplane. It works, and you can see it as a form called toroid, the form that Nikola Tesla described. We did some experiments with Masaru Emoto Institute from Japan. We wanted to see how it actually harmonizes other biomolecules. And they did a testing with a tap water. It was a frozen tap water. On the left, you can see the crystals before the treatment. On the right, you can see what happened after 10 minutes of hyperlight therapy. The perfect hexagons have been formed, and the scientists said that it is the optimal shape for the water to transfer the energy, to transfer the information. Of course, the light doesn't know if it hits the water is in the glass or the water is in our body. Maybe through my stomach it's not getting 100%, but in a certain percentage for sure. So it's doing the harmonization of water wherever, and structuring of the water wherever it is. This patent actually got an award from International Federation of Inventors. For the gentleman, it's like FIFA in football, but this is for the inventors. But I'm not a scientist, I'm a doctor, so I will focus on the indications that I can use Bioptron for and tell you about the mechanisms, how it works. First of all, and the most important thing, is it stimulates regenerative and reparative processes of the entire body. So you can read here what are the molecular effects. I will not bother you too much with that, but the point thing is increasing the number of macrophages, of fibroblast activity, and increases release of growth factors. For me personally, the most important thing and the most important group of indications that I have been using it for the last 11 years, it is the wound healing. It helps with the wound to heal 2 to 3 times faster, and even the most difficult ones. I will show you some examples. It's very important, it helps with the pain, it relieves it or it decreases its intensity, but it also improves microcirculation, stimulates the new vasodilatation, and the last but not the least, it reinforces your immune system. That's why I always like saying that Bioptron can be used even when you're healthy as a prevention to strengthen your immunity. Of course, most often we use it as a therapy during the disease, either as mono or more often as a combined therapy because it's complementary with all the other types of the treatments. And also you can use it in the period of rehabilitation, so after the disease. I will just give you a few advices about the immunity. Basically, we are using it, we are searching for the flat bones that are the most superficial, such as the chest bone, such as the frontal bone, such as the sacral bones, because in adults, in those bones, we still have the red bone marrow. I had the privilege of talking to Dr. Michael McNamara, the doctor who brought MRI to Europe, the doctor of the royal family in Monaco, and many famous athletes. He told me that he uses Bioptron every morning after his brushing teeth. He treats his carotid arteries for 10 minutes every day. And the whole idea is to prevent the creation of the atherosclerotic plaque, and potentially it can lead, of course, to a stroke. And he showed me some photos of erythrocytes before and after the treatment. So recently we did a similar study. We did a dark field microscopy experiments of the red blood cells before and after the treatment. So the effects lasted for several hours. They were glued together, stuck, not moving. They become separated, much more moving, and of course it reduces the chances of getting a plaque. At the moment, Bioptron is medically certified for about 45 different indications. So I put them in several groups to make it easier for you to follow me. First of all, for the pain relief, then for the wound healing, for dermatological diseases, but also for the, let's say, the health of the skin, and for seasonal affective disorder or seasonal depression. You will see it's completely safe for use in pediatrics and neonatology, but also in veterinary medicine, in dentistry. There are 3 different devices, 3 different models, but basically they all have the same effect. They are the same strength. The only difference between these 3 models is the size of the filter. The smallest one has 5 centimeter diameter, the middle one has 11, and the biggest one has 15. So basically, the small one was made for the home use. It can fit any purse, so you can take it wherever you go. My personal favorite is the middle one because I work with it for 11 years every day, and I have it at home working also, so it can be used for home and professional use. The biggest one is mostly for clinics because, you know, there are a lot of patients, so basically it saves your time. The optimal protocol for Bioptron treatment is 10 minutes, 2 times per day. In 10 minutes, it gets the optimal effect. So basically, it's like when you're charging your phone. So it reaches 100%. You can leave it all day long after, but it will not get over 100. It's like the same with mitochondria. So basically, it brings enough energy in about 10 minutes. So even if you do it longer, nothing bad will happen, except the device can be heated. But basically, there are no side effects on you. So about the pain, you know, of course, a lot about it. The whole idea is to try to exclude the painkillers because, of course, they have very much side effects, especially in the long term. So we did one of the studies that we showed that we can reduce the dose of ibuprofen by 50% in combination with polarized light and still get the same reduce of the pain that was with the full dose of ibuprofen before the using polarized light. Basically, in the medicine, when we talk about the pain, we use it mostly in 3 different branches. First of all is rheumatology, and we have a lot of patients with these rheumatic problems, with hip arthrosis, knee arthrosis, with all kinds of arthritis, including rheumatoid arthritis, you know, the autoimmune disease. So, of course, we cannot correct the deformations of the small joints, but what we can do is reduce the pain, reduce the swelling, reduce the inflammation, and help make their life much more easier, make their life without the symptoms. Departments of physical medicine are the places where you will most usually find Bioptrons in the hospitals. So they are using it in combination with all kinds of other treatments. The advantage for the patient is that he can continue his therapy at home. All he has to do is just to adjust the timing for 10 minutes and press the start. He doesn't need a doctor, he doesn't need some special training, so it's completely safe. The optimal distance is 10 centimeters from the body. And we have a lot of studies about this field. I didn't want to bother you with them, I just chose to show you 2, because, you know, with the pain, of course, it's individual. I cannot show you photos before and after that I will do with wounds and with dermatology, and the results are different for some, I don't know, young athletes, like Novak Djokovic. He will for sure recover faster than me from the same injury. I will probably recover faster than my parents. But I chose these 2 because they are very common. As you know, this is the most common fracture of the human body, the distal radius fracture. We did some study. This was the smaller version. Later it was expanded and presented on the World Congress of Rheumatology in Sydney last year. So the patients started using Bioptron after putting on the cask from day one. So they were treating the fingers that were outside the cask and the upper arm. After removing the cask in 3 or 4 weeks, the condition of the arm was significantly better in the patients who started using Bioptron from day one. And 0 of those patients has any serious complications such as this Sudeck atrophy. And Dr. Stasinopoulos, Professor Stasinopoulos, he's the Dean of Medical Faculty in Cyprus in Nicosia. He had a lot of studies. I chose this one because ankle sprain is what happened to all of us at least once in a life. So you know how painful it is, how swollen it can get. And also it can become your weak spot. So basically you twist the ankle, the same ankle later in life several times. The idea is to help the recovery, to strengthen the tendons, the ligaments, and of course, to stay healthy. The time of recovery is especially important for the athletes. You know, for them each day means whether they will participate in some event or they will not use it. So they really love using Biotrons, especially I know a lot of them carrying the small ones wherever they travel. Oh, on this photo you can see that the middle device, Bioptron Pro 1, has also a very useful addition. It's called the floor stand. So you can see in the middle it is very good for the lying patients. Like I mentioned before, my favorite group of indications for Bioptron is wound healing. And I'm not talking just about everyday wounds, I'm talking about the most difficult ones, such as a pressure ulcer, such as diabetic foot, such as burns, such as venous ulcers. So I will just show you photos and you will understand what I talk about. This is the lady from a retirement home in France, over 90 years old, who got pressure ulcer on her heel, opened. She's not moving 24/7, she's lying in bed, her circulation is almost non-existent, but they wanted to try using Bioptron and to see what will happen with her wound. They helped her, as you can see, from day 1 to day 67. Even in her condition, they managed to heal the wound. Probably the most impressive case that I witnessed myself is from the Serbia Clinic of Cardiosurgery in Belgrade. The patient with diabetes who came for a bypass surgery, but the way they took the wound opened and it got infected. And the team of doctors said the only solution for him to save his life is to amputate the leg. He didn't want to do that. He wanted to take a risk. And they decided to try hyperbaric chamber in combination with the biggest Bioptron. And they were using this combination for over 2 months, of course, cleaning the wounds, cutting necrotic tissue every day. So after 2.5 months, the wound got much smaller. So they only did some small skin transplantation, and he managed to walk out of the hospital with both of his legs. I always like to point out that diabeticians are especially important group for using Bioptron because with them first problems are with the peripheral circulation, and Bioptron stimulates peripheral circulation. And of course you can prevent the wound opening and help them close even if they open. This is from one clinic in Vienna, actually from here. So the pressure ulcer that opened on the hip, on the trochanter major of the femur. And as you can see, the results after 1 month, after 2 months, and after 3 months. This is a little girl from Romania who put her hand on a cook and burned it. Unfortunately, she has a Down syndrome and autism, and her parents were really scared whether she will accept Bioptron treatments because she doesn't react well to new things. But as you can see, she loved it, and what is the most important thing, it took about 2.5 weeks, 16, 17 days from the first to the last photos. The biggest clinic in my country, the clinic for burns, plastic and reconstructive surgery, the most important wounds go there. They just sent me some of their examples. So they are using Bioptron for the biggest wounds, for the burns, but also for the transplantation. So after the transplantation, the transplanted tissue, so it can be better accepted. I will just tell you something. I got the feedback from them that with such a large wounds, they get even better results when treating 20 minutes instead of 10. So basically, if you have such a patient, feel free to do it. We don't have such a difficult patients in our place. there have been different studies. You know, I'm sure some of you ladies who are here went through the problem with cracked nipples. You know how painful it gets and how difficult it gives the breastfeeding. So it can help a lot. When we talk about the dermatology, maybe you will be surprised, but the only one Nobel Prize ever has been given for dermatology, for medicine, of course. It was for Dr. Finsen's lamp, for the light therapy. The doctor from Faroe Island that invented the light therapy that was healing the skin tuberculosis. So that's where the light therapy entered the medicine. And we have really good results with all kinds of dermatological indications, except maybe vitiligo. Vitiligo only in the first stages, but later no. But dermatitis, eczema, psoriasis, symptoms of psoriasis, rosacea, herpes, your herpes on the lip, after just 2 or 3 days, you just remove the crust. I will just show you a few examples. This is one of my patients, a young girl with acne, who was coming from Monday to Friday just once per day. Then after the weekend, we made the new photos. So it was already, the improvement was already visible. Another patient from Czech Republic, she had severe problems with acne. The difference between first and last photo is about 4 weeks, as you can see. Also my patient with psoriasis on her knees, one of my first patients 11 years ago. So it took also 6 treatments for the symptoms to get reduced. But this lady, unfortunately, she has it on 70% of her body. So in her case, we had to use the biggest lamp. The small one took too much time, and I don't know if you can see it, but it was 18 days. So every 3 days is the new photo. This also lady had atopic dermatitis for over 20 years, the problems on her palms and behind the knee. She started using Bioptron, and it took between 3 and 4 weeks for the changes on her palm to disappear. So the itchiness and the redness. But for the knee, it took a bit longer, about a month and a half. So it was 6 to 7 weeks for this. Another example, similar type of psoriasis, but she was using also the liquid with fullerene to help the treatment, this treatment. One of the studies that I love to mention was done by a group of, let's say, most famous plastic surgeons in ex-Yugoslavia. And I like to use it because they did a smart thing. I told you the difference. It depends a lot of factors how fast you will have the results. But they were using Bioptron with their patients after facelifting, blepharoplasty, but using it only on one side of the face, and then compare it with the untreated side. You can see with this lady the difference after 5 days between treated and untreated eye. And with this gentleman, it took, after 7 days, you can see the difference. The treated eye is almost healed, unlike the untreated eye. It is being used a lot in anti-aging and aesthetic medicine, and it won a prize in Paris, in European Congress of Aesthetic Medicine. But I just like to point out it's not a magic lamp, so it's not like one treatment and the old lady goes in and the young girl goes out. The whole thing is about the production of collagen and elastin, the improvement. So you have to do like continuous treatment, like I said, to use it every day, like Dr. McNamara said. And it's being used quite often in this field, so to fasten the recovery after all kinds of interventions, such as mesoneedles, PRP, Botox, and so on. So I will just give you one example from Kazakhstan. This lady went to a beauty treatment, but as you know, you don't look really immediately the way you want, so it takes some time. But she was using it from day one, and it helped her. So you can see the difference in 10 days. Actually, our scientific team from Switzerland, they wanted to try to visualize the anti-inflammatory effects of Bioptron. So they did use some special Irish device that measures different things, but I would like to show you just the middle column, the inflammation. So it's after CO2 laser, before Bioptron and after Bioptron. So the difference between 2 photos is 10 minutes. So the anti-inflammatory effect is quite fast, as you can see, maybe even better on this photo. About the dentistry, to be honest, until 2 years ago, I didn't know much. I mean, I knew that I use it only wherever I have pain, wounds, swelling, inflammation. But then I visited the Congress in Rome, which was organized by the Professor Gianna Maria Nardi, one of their most famous dentists. And she did a lot of great examples, but I would like to say about this one that you can see on the bottom left. She was using Bioptron after the putting implants to the patient. So as you know, very often there is inflammation of surrounding tissue. So they had really great results with Bioptron, especially in combination with the blue filter. And another of her patients, kid who had a car accident and very nasty scars, as you can see on the photo. So on the right, you can see scar after 1 month, 2 months, and after 3 months. I mentioned at the beginning that it's certified for the seasonal affective disorder, and for the last 30 years, the bright light therapy with the light of intensity over 10,000 lux is being used in the first line of seasonal affective disorder problem. But as this pandemic happened and there is more and more people with all kinds of depressions, the studies have been done about different use of light therapy in different types of depression. So this was published recently by a professor from Harvard Medical University, and they did a study with light therapy and compared it with standard therapy for the patients with older people depression and postnatal depression. And the results were more or less the same, but with lots less side effect with this. The only difference with the treatment is that the protocol is once per day because of the hormone regulation, once per day for longer treatments early in the morning. So as soon as you wake up, you are doing this kind of treatment. My two favorite slides, Bioptron for pediatrics and neonatology. You know how important and how much safe it needs to be used for the newborns. A lot of hospitals around the world use it in these departments, so whatever problem they have. I just recommend that you use it for 1 minute per 1 year. 2 minutes, 2 years, 3 minutes, 3 years, because the ratio between body surface and the weight is different with the baby, unless the baby has my genetics. Also, another favorite study and example is using Bioptron in veterinary medicine. You know, with animals, there's no placebo effect, there's no auto-suggestion, so we used a lot of we have different animals that we use. We healed mastitis with cows. And this dog is from Split, from Croatia. I went there, we treated him for 2 days. After first day, the next time we came, he was waiting for us at the door and brought us to his chair and lied like this, you know, put his ear so we can treat it. So that's about the spectrum of the indication. I just like to mention that in Ukraine, in Kiev, in PhD studies, Department of the Medical Faculty, there is a book and there is an exam about the light therapy, the Bioptron light therapy. And actually, Professor Sergei Gulyar is, academic Sergei Gulyar, physiologist, is probably the world's leading person about the knowledge about the light therapy. So he published an article a few years ago in US-China Medical Journal about the whole mechanism as a physiologist of Bioptron use. So whoever wants, I can send it to him, this whole mechanism, if you're more into this molecular level. And actually during the sorry, you wanted to take a photo? Okay. So during the pandemics, it was actually included in the methodological recommendations of post-COVID and long COVID. The whole idea is mostly about the anti-inflammatory effect and regenerative effect. And this is the protocol that was given to use for the long COVID and prolonged COVID. Okay. And just 2 more sentences. Just want to mention, I said that Bioptron has a broad spectrum of the light. So what we did is actually they took out each part of the spectrum. So basically now you have different 7 colors as an addition. So I like to say that Bioptron is like pizza, and this is like, you know, ketchup, cheese, ham, whatever. So who needs more ham? Who needs more mushrooms? So basically, no, to tell you seriously, it's like each part has different physical characteristics. So the red part penetrates the deepest. So we use it as an addition when we need to have a stronger effect. Maybe you saw that we use it for the old lady in France. You use it for bones, for joints, and so on. Orange is my favorite color. I use it for all the soft tissues such as muscles, ligaments, tendons, for anti-aging also. Yellow is great for the swellings and for the gastric problems. Green is for the skin conditions. Blue, antibacterial or for the dentistry. Or if you have problem with your veins, so you don't want to heat it, you use blue. Indigo, for example, is great for people with sinuses. Of course, the first the first purpose when the color therapy was made, it was made for the chakras and acupressure points. As you know, each chakra has a color that responds to, so it's basically the first what it was used. And I mentioned that we made the special glasses. They work in a completely unique way thanks to fullerene. Basically, any kind of light that hits the lens with fullerene becomes transformed or more organized, and your eye is like a funnel. In your eye enters the portion of the light which is good in the condition, in the amount that is good. So basically, they became quite popular around the world. So but I don't care who wears them. For me, it's important why they work. So thank you very much for your patience. And if you have any questions, I'm here. Thank you very much. Thank you. Thank you. Thank you. Danke.
Thank you so much for this excellent presentation. Before we come to discussion, I have to declare something in German. Die Teilnahmebestätigungen sind zum Großteil noch nicht abgeholt worden von der Rezeption. Wir versenden keine. Bitte, jeder soll seine Teilnahmebestätigung, vor allem für die DFB-Punkte, abholen bei der Rezeption, bevor er das Haus verlässt. Nicht vergessen, beim Check-in